Seskehkó, Kahnawake. I'm Kellyann Meloche, a special advisor to the Kahnawake Education Center. I'm here to talk to you today about the safety measures for this year's school year. So first and foremost is that all students and staff need to fill out their online health forms for each day. This will tell us the status of their health each day and will also help identify for symptoms when symptoms do arise. So please ensure that all students and staff fill out your daily health forms. All masking for staff and students from grades 1 to 11 at all times. Separate entrances will exist at each school. This will avoid large groups at each entrance or exit. Social distancing while in classrooms. Although we have some classes, there is a space issue. Students will still be required to wear their mask at all times, and the Kahnawake Education Center will be looking at putting in plexiglass for those classes. Contact tracing logs for students and staff. Staff will be keeping records of where students and staff are at all times on school grounds. This will help our local public health team in contact tracing. Daily disinfection procedures in all buildings. Our maintenance teams have rigorous cleaning protocols in place. However, they have increased the disinfection procedures at all KEC buildings. We have superior ventilation systems in our schools that provide clean air to staff and students. This is really great for clean air exchange in all of our schools. COVID-19 screenings for unvaccinated employees. Implementation of an internal policy requiring staff to provide proof of vaccination, and if unable to, will have to undergo screening to prove they are negative for COVID-19. This came into effect on August 23rd. All the KCSC passed this at their August meeting. Thank you. And now Robin for some other points.
Seskehkó, Robin Delaronde. I'm the Director of Education for the Kahnawake Education Center. And today I'd like to address a few items. I have quite a list here, but there's going to be two areas that are key in this presentation today. The first one is I'll be talking about overall how our school opening occurred and some of the challenges and the success that we faced welcoming back all our students into our school. And second of all, the other main area I'll be speaking about is what parents can expect in terms of positive cases that will occur and continue, that will occur in our schools. And I'll give you a little update as to what happened this past weekend with a positive case that we already experienced. And then I also have a lot of, quite a few things of information and tips to give to parents and request, and also, I guess, outreach to the community in terms of some needs that we need in terms of staffing. So first of all, talking to you about our opening, this it's been 2 weeks now. And as you're quite aware that we opened our doors to all our students. As I've said before, is that the school opening, we really want to make sure, and we have made sure, that we have made it superior precautions in place than other schools in the surrounding area. So we continue to do that, and we continue to monitor based on the changes. So as you just saw with Kellyann and her presentation, even though we had initially put out some measures, some guidelines, that has changed for us as well. We're constantly revising, and we intend to keep you updated on any changes that we have to make or have had to make as a result of COVID and the size of our classrooms and so on. So this year, we opened our doors. We have a full house at our school, but we have had to make quite a few changes. We have had our students who are now in the classrooms learning. There's areas that we have to make some adjustments to and change, because one of the things that when we have our students back in the school is we don't want them in the lunchrooms. All of our students, what we've done is to make sure that they're in their bubbles, that they are eating their lunch within their classrooms. And with these extra precautions that we're putting in place, and Kellyann also spoke about the entrances into the building, that too requires additional monitoring. So because of this, our staff has been really working and giving a lot of extra time, monitoring in the classrooms. And what is happening is that they have their teaching load to do, they have their courses, and they've been giving like 200% to make sure the beginning of this school year is running smoothly and keeping children and themselves protected. And that means additional duties, monitoring the class, making sure that the students are safe. And this is something that they can do in the meantime, but I think, and I hope some of you have seen the postings for lunch monitors. And I am really putting out a plea to community that if you have that hour, if you have that space, that time, an hour and a half, and want to help education, help the teachers out, we really are needing your help to give us your name. To give us your name at the Kahnawake Education Center, contact Human Resources or our main office. And please provide us with your name, because our teachers, they are getting tired. They do need that break in the day. And any help we can get, please respond to the ads that we have been putting in the paper and elsewhere. So that is something that we desperately need and require in terms of support to keep our schools safe, to keep our teachers in a healthy and keep them well. So in addition to that, we are experienced, just like all over the country and elsewhere, human resource shortage. We do require, and if you know of anyone, we are still looking for Kahnawake speakers and French language teachers. So if anyone has any connections and resources to someone, please have them contact and respond to KEC Human Resource postings. So overall, those are some of the challenges we faced. But being in the schools, we've seen, and I've witnessed a lot of success. We decided to open our doors because of the feedback we had last year in terms of students' comments, seeing the overall effects that the social emotional well-being was having, negative impacts on our students. And we were adamant that this year plans are to continue to keep our doors open, regardless of a positive case that may occur in the school. And why, someone may ask, is why would we continue to do that? And that main reasoning is, number one, we all know we need to maneuver through this COVID pandemic, and that's what we intend to do. Our children are precious. We know schools are there for academic learning purposes, but the social, emotional, and physical well-being of our children is of utmost importance. And being in the building, seeing and hearing the laughter these past few weeks, I could really attest to the fact that that's what gives us all our energy. That's what gives us all that feeling that, yes, we can do that. I'm sure that's where the teachers are getting their energy, an extra boost to say, you know what, this is worth it. This is worth it for our children. So we're very happy to say that, you know, the children have quickly accommodated back to coming back to school, to being with one another. And they're resilient. Our children are resilient, and I was able to see that in the opening day, and we all saw that. So it has been a good start, and it has been challenging. So one of the things today that I also want to stress on and talk about is positive cases of COVID in our school. Last year, we had a few positive cases within the school, and we dealt with this quite quickly with local public health, and we were able to contain any further spread within our schools. This year we're dealing with a higher population, and we really have to work, and we really do intend to work collaboratively with local public health, more so in terms of contacting parents and outreach should there be a positive case in the classroom. One of the things we all had to learn as a community last year were the guidelines and measures that are required to keep everyone safe, even though we know there's always a risk. The things that we learned last year, and all parents and our children had to get accustomed to, and our staff in our school, was the fact that we needed to wear masks, social distance, we had to practice the hygiene and so forth. And we got ourselves pretty accustomed to that form of conducting ourselves, unfortunately, but fortunately it has helped protect us. Now we're at a new stage, and this is the part we need your cooperation as parents, and we need to advise you of new procedures, and you need to acquaint yourself with them and start to learn something new and something different, some different experiences. What I'm going to talk about today in terms of what happens when there's a positive case of COVID-19 within in your child's classroom is something that we have resources available. I'm going to show, we have a document here, and there will be 2 other documents that we're going to be sharing and forwarding to you as parents and as a community, so you have a better understanding and are more clarity. Unfortunately, should you be contacted that in your child's class or bubble there's a positive case. So the 2 documents, unfortunately, we don't have them ready at this time, but you will be looking at documents specific from the school. You will be receiving documents specific from the school, but also specific from local public health that'll help support you in understanding what could and the procedures that will happen should this occur. So one of the documents I'll just will look like this, and I'll go through this this document or this sheet, this graph, that will be able to give you a clearer guidance of how we're going to proceed and maneuver through our school year with COVID-19 when we do get a positive case in our school. Okay, so it's basically a chart that outlines certain procedures. Okay. What this document is going to state is that it gives you an indication of how we're going to communicate and how you will be notified if your child, there's a positive case. So first and foremost, what occurs is that at each school, the administrator will immediately be contacted by a representative from Kahnawaga's local public health. They will contact them and advise them that there is a positive case in your school. They will identify who it is, and that begins the protocol and the chain of how we respond quickly and what information the school is responsible to bring forth to local public health, so that the whole intent is these measures are implemented and we can contain any outbreak and any further spread of COVID-19 quickly. So this, just so you know, some of the procedures I'm going to state today are what we did this past weekend with the positive case at Kahnawake School. So local public health contacted designate at KEC. Then what happens then is that the school reps, whether it's the school administrator, safety monitors we have in our school, immediately go to the school, collect all the contact tracing forms, information we have on that student, and gather that as well as phone numbers. And what we do is we provide this picture to local public health. So local public health then goes through that information along with, of course, on their end, they are speaking to the individual who is positive and gathering their source of information as well. Once we give this information to local public health, we have prepared letters that will go out to our school community and parents and teachers, as well as to the specific classroom or classrooms that have a positive case. So we're preparing for that on our end. At the same time, we are preparing our school maintenance to give them further information about the location of the positive case and any other areas that require extra cleaning and maintenance and sanitization. As we wait for more information and local public health going through the information we've given, we are then advised, once they've thoroughly analyzed the situation, in terms of how we're to proceed. With the schools and with the large numbers now we have in our actual classrooms of 15, 12, this would be a heavy task on local public health now to be contacting all the families, in addition to other cases that they're probably dealing with themselves. So what we're going to be doing is collaborating with them to support them and to support families with information. If your child is a positive case, is a close contact of a positive case, okay? So what we're doing is immediately we have the letters there, we have the information of what a parent should do. And what we do is the school will then be making contacts to these parents, advising them. We are not there to advise, we're not dealing with the positive case. I want to be clear about that. That's local public health's role to do that. What we are doing from the school perspective is sending out the letters to parents, advising them that your child has been in contact with a positive case. And we're advising family of it, and there'll be a second documentation, a second paper that's going to clearly indicate what they now should do. Once you receive this information, parents, this is your next step of what's important, what you need to do. So we are going to be either through emails, could be a text to the parents, sending you, notifying you that you have received an email, your child is a contact of a positive case, we need you to check your emails. All of that information is going to be in there for you to review. Currently, what we've determined is that if this situation happens in that bubble, in that classroom, that we are going to implement where the whole classroom would immediately go on 10-day remote learning. So we would close that classroom, that bubble, and the whole classroom will revert to remote learning. This helps give an extra measure of protection for everyone in the classroom, for the whole school community, and our schools will be given out further information about how that transition into remote learning begins, okay? So that's important. That you understand that. At the same time, the whole school, system-wide, and parents of that particular school will also get a letter notifying that we did have a positive case in the school. If you don't get an email that says you are a close contact of a positive case, then we need you to be reassured that this is to notify you. We're being transparent. We're saying that this bubble had that experience, we're notifying you of that, and the expectation is that we all continue to keep monitoring our health, doing our daily health checks, making sure we're all well, and making sure that we're all continuing through the procedures, and the next day school resumes as normal for the rest of the school. Except for that one class or classes that are now on remote learning. One of the things that's really important too, that is a message connected to this, is phone numbers. We asked parents, we know we had you fill out registration forms and phone numbers, emails, but during this time even more so, it's crucial that you update your school administrative assistant or receptionist at your child's school of any new phone contacts, phone numbers. If you've changed anything, please advise them so we can make the appropriate corrections and contact you immediately. So this is the information that we want to relay. This is our new measures, new normal, that we're going to have to become accustomed to. This past weekend when we had the positive case, I'll just say that going into Cattery School on that Monday morning, I was checking with the staff and checking with the reception and admin, saying, did we see a change? Did we see some parents not send their child in because they heard that? because of a positive case. Of course, there was other reasons why parents didn't send their children in, but not particularly because of that situation. This tells me that two things. Number one, you as parents as well, you know and understand how important school is for your children. You know that it's a place where your children need to be. It also tells me and tells our schools that you believe in our schools that they're safe. We know there's a risk, no matter how safe we're going to make it and put measures in place. We all know there's a risk. There was a positive, we have cases, but we're easily we contain and respond to this. We've been able to contain any further spread. But it tells us that those two things. You know your children need to be in school. You have faith in us that we'll implement the measures to keep things safe for your children, and that we need to now be in this next journey, I guess, is in terms of entering back into school, going into remote learning, coming back in, and making other plans. And I thank the parents who, unfortunately had to experience this. I thank them for the feedback, the questions they asked, because this helped us. When we made the calls, they had things they needed to know, and it helped us determine what further information we need to give you. Thank you for helping, complying with some of the measures here that we had, where you went to get screened, have your child screened, and so forth. And to the staff, to the teachers, who still going along, prepping work so that these children can be back and learning, whether at home and back in school. So today, that was the main information I wanted to relay, is that, our start been challenging, it's been successful. New things we need to expect and work together on. And information, parents, we really need your most updated info. We need you to keep doing those daily health checks. We need you to ask your children when you're doing those daily health checks, don't just go check, check, check. Ask them, how are you feeling today? How are you? What are you doing? How are you feeling? These are so important. And make sure that, they're handed in so that we can make sure we're not spreading the virus within the school. One other thing they knew I was coming on, and they were saying, remind parents of this, remind parents of that. One of the other things is with remote learning. All our students are preparing to have their Chromebooks. Some have them all deployed. But a reminder that we're not fully deployed all of our Chromebooks, so students can go on online learning, to remote learning should there be a closure. This is due to the fact that we need parents to sign forms. Some parents have still not signed the forms that sign out their Chromebooks, the agreement, and there's some billing issues as well. So it's really important that if you haven't done that, you do this. This helps make our year really run smoothly. And a reminder, we desperately need other hands to help us with lunch monitoring. So if you have that hour and a half, to commit to one of the schools, if there's a particular school you want to be a lunch monitor at, let us know. Our teachers need you, and if this is one way, please apply. So for today, that's the information I have. That's the information I want to relay, and just to look forward to, like I said, more documents we'll give out to all parents. So this isn't a shock to them when they see this, when they see a form about your child has to isolate. This is what you have to do. We'll make sure all parents see these forms. So Kahnawake, I wish everybody well, and all the best to remainder of a good school year. And I remain positive, as I said, but we're only human at the school, just like all of you, and we need everybody's help to make this a successful school year. So Zetni Zeri Yohak and Kahnawake.